Welcome back to Smitty's Learning Room. Today we continue to have a look at the HSC option Sports Medicine. And we're going to have a look at the focus question. What role does preventative action play in the well-being of athletes? And we'll start by having a look at physical preparation. So when we have a look at the syllabus, we're in the Sports Medicine option and we're having a look at the focus question. What role do preventative actions play in enhancing the well-being of the athlete? And we're going to start today by having a look at this concept of physical preparation and these concepts here. So we're going to have a look at how each one of those can enhance the well-being of an athlete. So when we look at the concepts which come under this preventative actions, we look at physical preparation, sports policy and the sports environment, environmental considerations, and taping and bandaging. So you need to know all of these concepts and what role they play in enhancing the well-being of the athlete. Now today, as I said, we're just going to have a look at physical preparation. So when we look at physical preparation, what are we talking about? So we look at the concept of pre-screening of athletes before they start to train or perform. We look at skill and technique, physical fitness, and warm-up, stretching, and cool down. So this video will go through these four concepts and how do they actually impact the well-being of an athlete. So we start by having a look at this concept of pre-screening. Now what is pre-screening? And it's basically screening an athlete or testing an athlete before they perform or before they're allowed to train or return to play. And it's required mainly when athletes have been inactive for a period of time. So for example, an athlete may have gone and had an operation on their knee and may not have been active for say 6 months. And so a doctor or a sports practitioner might do a pre-screening before they actually allow them to return to training. Often you'll see pre-screening occurring if an athlete has a pre-existing injury. And so an athlete might start with a new coach or join a new team, and that sports practitioner might say, I need to do a pre-screening of you so that I can assess if you've had any previous injuries. And what it sort of looks like is, there might be like some tick boxes or some questions. So for example, here you can see, have you had more than 3 months of inactivity? Do you have any existing injuries and what are those injuries? So some of you may have even been to a doctor before or a physio where you've had to fill out these sorts of forms, and this is what we call pre-screening. And so now we look into the issue of, well, why is pre-screening so important for us as sports practitioners for athletes? And the reason we pre-screen is because it allows for doctors and sports practitioners to collate information to pass on to the coach or the trainer. And so once the coach or trainer has that information, they can actually use that information to increase the suitability of a program for the athlete to maybe perhaps meet the demands of either their current injury or their previous injury. And also obviously will allow for an increase in results as the training program is specifically designed from that pre-test or the pre-screening findings. So for example, if an athlete is suffering from chronic knee pain or they've had a knee operation, a coach is obviously going to tailor a program which ensures that they're not putting a lot of impact on that knee, thus allowing for improved performance because they're getting the best performance out of the athlete that they have and the situation that they're in. If we don't do this pre-screening and an athlete goes to start training again or they start with a new team, squad or coach, this is where injuries can occur or training types or types of training can actually affect the athlete because their body is either not ready for it because they've been inactive or because they're suffering from injury or returning from injury. So the next concept we have a look at is skill and technique. Now when we have a look at sport and risk, they literally go hand in hand together. So with sport, we know there's going to be some level of risks, particularly with high impact sports, and also when we start to get to quite an elite level of sport, it's going to increase the risk when you participate in that sport. And therefore, if we have an increased risk of a sport, we're going to obviously have increased injury. And around this concept of injury, this is where we get this idea that it's really important to develop skills with correct technique. So obviously high risk sports need to have a lot of focus placed on developing skills with correct technique. So we know from previously when looking at categorizing injuries, we know that obviously the correct technique or the incorrect technique can lead to a lot of injuries. So for example, incorrect foot strike can lead to tendonitis or aggravation of tendons or ligaments within the body. Incorrect landing technique can also lead to sprains, strains and tears of ligaments. So for example, in sports like netball or basketball, if an athlete is taught to land incorrectly, this can also place a large impact on ankles, knee joints, that sort of thing. When we're looking at sport like rugby league, if an athlete isn't taught the correct skill or technique for a tackle, this can actually go on to cause injuries such as concussions and that sort of thing. So when we have a look at this concept of physical fitness, we look at it sort of as one thing sort of leads to another. So if we have an increase in our physical fitness, this will then lead to an increased capacity to deal with the demands of sport more effectively. So for example, if we're training consistently and then we go and play a game and our training mirrors that game play, as in we normally train for about an hour and we play for about an hour, our body is able to deal with the demands of that game because we've been training for them. We've increased our physical fitness. And obviously, if our body is ready for the demands of that performance or that sport, it's going to decrease the chance of injury because the body is prepared both physiologically, physically and mentally. And then obviously, if we have this physical fitness, it's going to increase our time in which we can participate for. So you might see that, let's say for example, in a 10-kilometer running race, an athlete who has been training consistently for quite a period of time will be able to run that whole 10 kilometers. Whereas if somebody who's just entered the race thinking, oh, this is not going to be an issue, I can actually run 10Ks, I ran 10Ks last year, but hasn't done much running since, may find themselves not being able to participate or complete the whole run and having to walk sections. So increasing physical fitness allows us to increase the time in which we actually participate in the sport for. It can also allow for increases in intensity if we program that within our training to do physical fitness of increased intensities. The final concept that we have a look under this one is warm-up, stretching and cool down. Now these principles are crucial to injury prevention. Warm-up and stretching also assist in the body in preparing physically and physiologically for performance, and obviously when we cool down, this assists us in recovery. So when we look at the concept of a warm-up, we know that a warm-up prepares the body for performance by increasing the muscle temperature. And obviously, if we increase our muscle temperature, we can increase the speed at which we contract our muscles and therefore increase our muscular force. So obviously, if we have increased muscular force, we're going to have increased speed, which is obviously going to allow us to perform better. We'll also have increased muscle elasticity. So if we're warming up, our muscles are warm, they're elastic, which is going to decrease injuries around our joints to our ligaments. So you'll often see sometimes if an athlete doesn't warm up and they go and play sport and they move quite quickly, this can cause injuries to knee joints, ankle joints, shoulder joints, and sometimes to specific muscles. The process of warming up obviously gets our heart rate increased. It gets our body moving, and because it gets our body moving, it then allows our body to activate our sweat glands and activate sweating, which allows us to begin the process of cooling our body. And so that means that our body's not under that stress while we're trying to perform in a game or a race or something like that, because our body has already started that process and it's going through the cooling of the body while the warm-up is happening, and then can just continue throughout performance once performance starts. The warm-up will obviously allow for an increase of joint range of motion because of this increase of muscle elasticity. And finally, a good warm-up should increase mental readiness for performance, in that the warm-up should not just be about increasing our heart rate, but also, especially if it's a game-based performance, it should be looking at a warm-up that is specific to or has skills or drills specific to the performance which is about to be performed, to allow the athlete to sort of have a bit of mental rehearsal of what that might feel like. So when we look at a warm-up for athletes, it needs to be a minimum of 10 minutes light aerobic activity to allow for the heart rate to increase and allow our body to begin to prepare for performance. So things like allowing our body to start sweating, to cool down, allowing our muscles to warm up and become more elasticity. And obviously this is going to vary depending on the sport, depending on whether you're an elite athlete, depending on whether you're a beginning athlete, depending on whether you're going for a marathon run versus a 5-kilometer run. And this obviously needs to be designed in conjunction with the coach or the sports practitioner. And coaches may include stretching within the warm-up, but it's more common that an athlete will be engaged in a dynamic warm-up. And so this then brings us to the concept of stretching. Where does stretching fit within this warm-up cool-down process? And so there is little research that suggests that stretching actually decreases injury, but we do know that stretching does increase the range of motion and flexibility. Now, I'm not going to go too much into the different types of stretching because you can actually go back to the video. There's a link at the bottom of the screen which will show you more information about these different types of stretching. So when we look at the different types of stretching, we have PNF stretching, which is proprioceptive neuromuscular facilitation stretching. We have static stretching, dynamic stretching, and ballistic stretching. So if you're not sure what these are, I suggest you go back to the stretching video. And as suggested earlier, a coach will often use different stretching techniques within a warm-up and also within a cool-down. You're most likely to see dynamic stretching occurring within a warm-up, and sometimes it's more like static stretching or PNF stretching in a cool-down. So when we talk about this concept of a cool-down, if we're using stretching in it, a cool-down is similar to a warm-up in that it should last at least 10 minutes. And this is obviously, again, dependent on the type of sport or performance or how long the athlete has actually performed for and how intense that performance was. And it should just be a moderate activity of decreasing intensity to slow down the heart rate. So basically what the aim of the cool down is to decrease the blood flow. And the reason we want to decrease blood flow is because pooling of blood in the muscles from a lack of a cool down causes injury and slower recovery. So there is evidence to suggest that an effective cool down decreases blood flow, and because you have that decrease of blood flow, our body is able to return to play much quicker because we're able to recover faster because we haven't got pooling of blood in the muscles, and our muscles are ready to perform again much faster. So tying it together, remember that today's video is having a look at physical preparation in relation to preventative actions in enhancing the well-being of the athlete. So we've had a look at what concepts in relation to physical preparation can enhance the well-being of the athletes. The future videos will have a look at sports policy and the sports environment, environmental considerations, and taping and bandaging. And these four concepts come under this focus question.